That was a study based on the DANUBE phase 3 trial. This was a first-line trial where patients with metastatic bladder cancer, fit or unfit for platinum-based therapy, were randomized to receive either carbogemcitabine, platinum gemcitabine for the chemotherapy arm, or versus Durvalumab, or versus Durvalumab Tremelimumab. The endpoint of this trial was overall survival in PD-L1 positive Durvalumab versus chemotherapy, and the secondary was in overall population Durva-Treme in unselected population versus chemotherapy. Unfortunately, the trial was negative. Only the secondary endpoint of Tremelimumab in PD-L1 positive was positive for survival. And this raised the question of what is PD-L1 doing here, if the scoring that was used was adequate, or maybe using the other algorithms that have been used with other agents like nivolumab, pembrolizumab, were useful to predict outcome with a PD-L1 positivity. And then we did an analysis using the combined positive score, that is tumor cells plus immune cells divided by the number of tumor cells, more than 10%, the CPS score more than 10%. We use the IC, that immune cells more than 5%, that is being used for atezolizumab. And we use also the more than 25% in tumor cells on immune cells. That was the score used for the Durvalumab. And also we analyzed a score more than 1% or less than 1%. What we saw is that using the different algorithms, meaning immune score more than 5% in immune cells, or the combined positive score, or the more than 25% in tumor cells or immune cells, all of those were predictive of survival for Durvalumab treated patients. So the only score that was not positive was less than 1%. So based on that, is still PD-L1 might be useful still to be like predictor of outcome and being implemented in future trials. So the fact is that based on the positivity of the results obtained with Durva-Treme in a PD-L1 positive, in the NILE study, that is a subsequent study that AstraZeneca is conducting, in this case, combining chemotherapy plus immunotherapy versus chemotherapy versus two other combinations, one of the endpoints was changed, and it's like if the PD-L1 positive patients receiving Tremelimumab might receive a survival benefit when receiving immunotherapy. So that's this let's say more expanded way to analyze PD-L1 staining was really helpful to still keep PD-L1 as a potential predictive factor for outcome in bladder cancer patients.